The role of the Council's Environmental Health Department is to protect the public health. A lot of what we do is based on the legislative requirements. Here is just a snapshot of our day, beginning with the Immunisation Clinic. Council provides an immunisation program to protect the public from vaccine-preventable diseases. We have 15 public clinics at 12 different locations each month, and we visit all the secondary schools in Greater Shepparton. At the clinic, your immunisation records will be checked and you can discuss any concerns with the staff. Your records would be updated and you will receive information about the vaccines and when you need to come back again. A nurse and doctor will administer the vaccines and will talk to you about the possible side effects. Just so we know everything is okay, we ask you to wait for 15 minutes before you leave. Meanwhile, another environmental health officer conducts an inspection of a tattooist.
Council needs to register all tattoo premises, so anyone that wants to run a tattoo business needs to register with their local council. Part of our process is also to inspect them annually. So what we would do is we would just plan those visits across a year, and an officer would come out and look at the premises. We'd introduce ourselves to the proprietor and we'd look through the premises to make sure that the equipment's clean and that they're following the right process for sterilising the equipment that they're using. Part of the inspection process is that we would also ensure that the proprietor is following the right information about protecting clients, and so they need to give them a client information sheet for the procedure they've done for tattooing. They also need to make sure that they're only tattooing people over the age of 18, so they need to keep a record of that. We also would fill in an assessment sheet, and if there was any issues we would follow that up with the proprietor at the time of the inspection and maybe a follow-up visit if it was necessary.
The Environmental Health Technical Officer also visits tobacco retailers to make sure they are displaying the relevant signs under the Tobacco Act. We also conduct a test purchase to make sure the retailer does not sell cigarettes to minors. Last year, we checked 32 retailers, and unfortunately 2 retailers did sell cigarettes to our test purchaser. We followed this up with an interview and provided information about the Tobacco Act. We will do another test purchase at a later date to be sure they don't do it again. The next job for the day is a food premises inspection. Upon arrival at a food business, we wash our hands at the hand basin. We check to make sure that there is liquid soap, warm running water and paper towel. It's important that all food handling staff wash their hands at the hand basin regularly. The use of hand sanitisers and disposable gloves are no substitute for proper hand washing. We look at how the food is stored in the cool room to make sure it is stored below 5 degrees Celsius. We also look at how the food is stored to make sure that there are no signs of cross-contamination. We check the dry food storage area to make sure that the food is stored in containers with tight-fitting lids. We also check the use-by dates and we look for any signs of any pests. We have a look at how the clean equipment is stored to make sure that there are no signs of defects. We look at how the food is cooked to make sure the temperature of the food is above 75 degrees Celsius. We then make sure that the food is going to be kept hot above 60 degrees Celsius once it's cooked. We have a look at the cleanliness of the cooking equipment, including the exhaust canopy, ovens, the hot plate. We also look on the floor and the walls, and we look for signs of grease build-up or any defects in the flooring. We have a look at the wash-up facilities to make sure that there is hot running water, detergent and a sanitiser. We would have a look at the food business's food safety program records, just to make sure that they're completing their records as required. Can I have a look at your temperatures? Another job for the Environmental Health Officer is to review and approve the installation of new septic tank systems. We need to make sure the wastewater does not contaminate the environment. We will arrange a site visit to check that the waste can be disposed of within the property boundary. We will also look at whether there are any channels or dams that restrict the location of the disposal system. The Environmental Health Officer can provide information on the different treatment and disposal options and explain what information is required to be submitted with your application. The Environmental Health Officer also reviews any planning or building applications in unsewered areas to assess how the proposed development may impact on the existing septic tank system. The Environmental Health Officer inspects caravan parks with the CFA to make sure they comply with the legislative requirements and the CFA's guidelines. There are 19 caravan parks in our municipality. Some of the items we look at include the distance between the structures to make sure they allow for safe firefighter access. We look at the fire hose reel locations to make sure every site within the caravan park can be reached. We check the location and working order of the fire hydrants. We make sure the cabins and caravans are clean and have a working smoke detector, fire blanket or extinguisher, and have an emergency evacuation procedure displayed. We look at how the gas bottles and electrical cords are stored. We look at the cleanliness and structure of the toilets, the laundry, recreation rooms, pools and barbecue areas, and to make sure they also display the emergency evacuation procedures. Finally, we look at their emergency management plan. The Environmental Health Officer undertakes a food sampling program.
Our program's designed so that we collect a range of food samples, so it might be from takeaway premises, sandwiches, ice cream, salads, and other premises. We also have to collect it from Class 1 premises, which are high risk, so childcare or aged care. So what we do is we plan that in advance and then we head out to premises. We don't tell them we're coming, but when we arrive at the premises, we obviously introduce ourselves to the proprietor, tell them why we're there, and then choose what food samples we're going to collect at that time. We ask them to make them if we need to, then we actually pay for the sample. We then wrap it in our ask them to wrap it first how they normally would, and then we'd wrap it in our packaging, label it, and put it in our SD or cooler bag. It then gets taken back to the office and packed with the rest of the samples. It gets sent to Melbourne for analysis at a laboratory in Melbourne. It can take about 2 weeks for results to come back, so we explain that to proprietors when we're there. They then wait for those results. Generally, most samples pass. On the odd occasion, they don't, and so we have to go back to the premises and explain with them and try and work out why they may not have passed the results or required levels.
Greater Shepparton City Council has a mosquito monitoring program, and we monitor adults and larvae in the water. We're monitoring for disease. Back in 1974, when they had rather large floods around here, there was an outbreak of Murray Valley encephalitis, and they decided to start up a mosquito monitoring program to try and avoid that. It involves adult monitoring, which is setting up a trap and running it overnight once a week between the months of November and April. And we've also got larvae monitoring as well, where we go out and we sort of dip in a pond or a puddle or anything like that and see if we can find larvae in that water as well. Important that we monitor mosquitoes because of the diseases that they can carry, that they can pass on to human beings. We've got 4 adult monitoring stations, and we've got about 130 larval sites that we monitor as well. We usually test the adult mosquitoes. We send them down to an entomology lab in Melbourne. It's part of the Department of Environment and Primary Industries, and they count the species, the gender of the mosquitoes, and then they take samples and try and extract arboviruses from those samples. If there's any samples that come back positive to an arbovirus, they then notify the council and the state health authorities. We've got a sentinel chicken program. We've got 20 chooks stored out at a property along the river, and the veterinary officers go there once a week and they collect a blood sample, and that blood sample is sent down to the entomology lab in Melbourne, and they can check that blood sample for arboviruses, in particular the Murray Valley encephalitis. If there's viruses found in the blood samples, then the lab notifies the Victorian Department of Health as well as the council, and that gives us 2 weeks warning that it's potentially going to appear in the human population as well.
This is a little snippet of some of the work we do in environmental health. For more information, contact us on 58 329 731.